Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
We are back.
Yeah, we are back with this great subject of neglect of homebound patients. And can you go there and give people flu shots? Can you wait?
We do. Well, let me tell you how we work.
Wait, excuse me. Describe what a homebound patient is. Is it just someone who all of a sudden just can't get to the doctor, or they have a bad back, or what is it?
In Europe, a homebound patient is a person that is so sick that they don't have the strength of the ability to make it to a doctor. Automatically become a homebound. So in Europe, we get a lot of home visits to people that are not homebound by definition in the United States. In the United States, you have to be basically completely disabled. If you can get on a bus and go to see the doctor in a stretcher, then you are not homebound.
Amazing.
It's crazy. But there are two types of, in my practice, patients that come to the office and somehow they decompensate. They are falling and it's difficult for them to drive and they don't want to get into an accident. And they call the office and say, I need a home visit. For that, at that moment, you have become homebound. And a lot of time we'll go do an assessment. The last patient that I saw, the son brought her to the office and she has a couple of bruising on her leg. I said, what's going on? Well, she had this bruising. So he said, Mom had been falling. And I said, well, she's declining then. So we're going to put some physical therapy at home. So he said, wouldn't she do better going out for physical therapy? She's not ready for that. We have to do home physical therapy, let her graduate from there. Then we'll do a reassessment, and if she's good enough to go out, then we'll go out. So we educated the son, and the son is in healthcare. He's very much involved with healthcare. And the son said, okay, I think that sounds like a great plan. So at this moment, she is more or less homebound, and the only way she can come to the office is because the son can bring her when he's in town. But when he's not, she's not being seen. She's being neglected. So, whenever you feel that you coming to the doctor, is very difficult. It takes a lot of manpower. You have to call here, you have to call there, then, you have to go downstairs. That is difficult. You have to sit on the steps, like one of my patients was saying. I sit on the steps, and then with my butt, I just go down one step at a time.
Oh no, that is a homebound patient.
And I say, honey, you don't have to do that. We'll come to the house for you. And then, because she want to feel the freedom of going to the doctor, I say every 6 months, I let you come to the office. And then even every 3 months if you're strong enough. And we took this patient. This was like 8 months ago, something like that. She already came for a visit. And she came for her 6-month follow-up. She came to the office. And this month she came again for another follow-up because she said, I feel so much stronger. But we put everything in place in her house so that she can make sure her medication is being delivered to her so she doesn't have to go and get it anymore. And physical therapy was there, and the occupational therapy came over. And they look at the bathroom, and they make the house, her condominium, safer for her. So now that she has more safety, she has more freedom. Once you have that freedom, you don't keep decompensating, like that's this patient I saw with her son. We can restructure things to help the patient come back and maintain the best quality of life possible.
So what you're saying is someone could be a homebound patient maybe when they start, and then through your caring and knowledge, you can make them where they actually can come back to an office.
Come back to, exactly,
but
be independent.
There are a lot of people now with Alzheimer's, as you know.
Absolutely.
A lot of people are at home, and they become in fetal positions. I mean, I had this with my mother.
Yeah.
They cannot come. I mean,
they cannot come, and those are permanent homebound patients, and, we have to have permanent services coming in.
You still have to take care of them.
We have to take care of them. And some of them with end-stage Parkinson disease, they cannot come to the office. Patients with end-stage emphysema or COPD, they cannot come to the office. And there are multiple medical problems that they have. And because they are, homebound and not getting the care that they supposed to be getting, we lose the communication between providers. So the patient become a garbage truck,
You are right.
You get all this medication coming in, the eye doctor is refilling and the other doctor is refilling, the rheumatologist is refilling. And, the patient become the garbage track. You just have all this junk coming in, and we go in to clean up and say, wait a second, we don't need to take all this medication. Well,
Dr. Mencia, it's like we're talking about maybe something happens to us and we get much older, and we don't want people to treat us like nobody. Remember, that's a saying once for somebody. We don't want to be nobody, and that person may have COPD or that person may have Alzheimer's. They're still a human being, and they're living, and they deserve something.
I always tell my providers, that my nurse practitioners and doctors that go to the home visit, and I look at one of the social aspect of the patient, and I read it, and I say, patient retired, non-smoker, ex-drinker, no drinking for so many years, blah, 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 no drug or alcohol abuse, and that was the end of the story. So I call my staff, and we have a meeting, and I say, look at the social history and what is missing. Say, well, looks basically okay. I said, it doesn't look okay. Because what gives you the pride as a provider to go to this person's house and take care of that person? I say, I don't see anything. I say, of course you don't. Well, this person dedicated maybe 60, 70 years of his life for society. He was the founder of a company. He was president. He had hundreds of people working under him. So he provided for hundreds of people, hundreds of family that work under him. That is missing. What are you retired from? What did you do? We have one guy, he was he passed away a few years ago, the founding father of Motorola in Israel.
Really?
I say, to me, it was an honor to take care of this guy when he was alive. The founding father of Motorola. I mean, USA Motorola went there and bought him out and brought him to the United States. And, why are you doing this? Anita Finley is my patient. So who is Anita Finley? What did she devote her life to? Mother Natasha, being my patient. What did she do in her life?
That's right.
So we have to look at the social aspect of the people that we care for. It's not just the person here that is there that, I'm retired. Retired from what? What do you do?
Smart.
So I always tell my provider, go ahead and find about what will give you the honor of going to this person's home.
This is a perfect segue for me to tell you something. I used to go to nursing homes a lot more to volunteer and just talk to people, and I do some helping. And after, just like you said, I would talk to people and I would say, oh my goodness, this person is this, and they have very interesting lives. And yet, a lot of times the help in the nursing homes had no idea.
They have no idea who they're taking care of.
That's right. And the person's lying there, and then maybe they can't speak or they don't tell them, and they're not treated, even if they were if they were a housewife. I don't care who they were. They didn't know. So I'll never forget, I went to the administrator and said, would I be able to write down who a particular person is, type it up, frame it, put it up on the wall so people who come in know what this person was. You know what they told me? What do you think they said? They said no,
privacy.
and that's it.
That's
privacy. What they said. It's because of privacy we can't let you do that. Dr. Mencia, that is outrageous.
That is outrageous. I mean, our society needs to restructure certain things to provide better service to our community. Because one day you and I are going to be there.
Absolutely. And people we love, it's not right.
It should be the patient's decision. Yeah, I'm okay with you putting that stuff because I'm proud. I have one of my patients that one of the nurses in the nursing home say, "Oh my God, you're such a great doctor. Look at you. You are pushing the patient around in the wheelchair." I said, "You know who that is? That guy was a pilot. And he got hit 3 times. His plane went down 3 times defending this country. And he got back on a plane and continued to fight for the United States. I'm proud.
I have goosebumps.
I am proud to push him around.
Yes. You see, but just think about the outcome.
If I get knocked down once, I won't get it back on the plane.
Well, but you're right. But wait, think about it.
He got off 3 times and went back up there.
Okay, so now you have the person, people know who they are. Think about this person who maybe they're a worker who didn't have much education. They could be proud of who they're taking care of. Then they would say, go home to their family and say, do you know the person that I'm taking care of was blah, 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 or they had 10 children, or I think it would work all ways. And I don't know how to get it changed, but I mean, I just think that we're missing out.
Well, I think one of the ways we can get it changed is when your loved one or yourself, if you are competent to make decisions. So, I heard Anita and Dr. Mencia on the radio, and they were saying about putting the history of what we have accomplished as human beings. And I have no objection. I want to put mine up there and request that you start.
I'm going to get this in your column. I'm going to get this in your column. We're going to talk about that.
Because, it's your history. You do things for society, so many things. I'm so proud that I was one of the first non-Caucasian president for the United States Taekwondo Federation. I'm the first. I was
who were they before? What did they do before? They were
for the United States or Caucasian president for Taekwondo, and Taekwondo is an Asian martial art. So even Asian had a hard time becoming
Asian.
Yeah,
so it's
Asian, but to become president here, it usually was Caucasian because the association was led by Caucasian. So they would choose among themselves, and even though there were blacks in there and other non-white, usually white would be elected as president. So, I'm proud of that. I tell my kids about it. I was the president for the United States Taekwondo Federation. I was the first chairman of anti-doping worldwide. So if I start looking at my personal accomplishment, I was the founder of AGI, Adult and Geriatric Institute. You start looking at your accomplishment.
Yes.
Yeah, I want people to know who I am if you're taking care of me in a nursing home.
We have to, this seems like it's not as hard as if it comes the other way, if we start the movement, if we say, okay,
we
if
are
you go
right
to a
now.
nursing, we are. And we're going to put this in writing because I think it's really important. As a matter of fact, I know you're going to laugh at this, and I don't know if maybe it would be allowed. What if you have a lot of wall space at AGI? Mm-hmm. What if everybody who wanted to have a little 8 by 10, someone could type it up. I would even take on responsibility, but no, it should be from your office, I think. Mm-hmm. You could have their picture when they were younger, however you want. These are my patients. Have the wall of golden people. And you just line them up and people would walk there and read them about all the people who you take care of and who they are. I just think, I love this.
I love it.
You could have a wall like they have a donor wall in the hospitals.
Right.
You could now have the wall of your patients and they could.
That's a great idea.
And for the first time they would be important. They'd be somebody.
Yes.
You have to say what their illness is. You just say who they are. These are my patients.
Their social part.
I think we just created something.
Yes, we have.
The wall of it. then you would really be giving people something that doesn't cost really money. It's just going to be a little time and effort, but they'll come in and they're going to bring their friends. It's a great marketing tool. I'm sorry. It's a marketing tool, but I'm past that. I'm into the human being.
Yeah. I remember having a patient that, she's talking to me and I said, well, in the social aspect, what did you do? She said, I was just the housewife. What do you mean? You were just a housewife? And so we kept talking, and she has 7 kids, one died. So she has 6 kids. And one was a judge, 2 lawyers, one was a nurse, one was a doctor, one was had a PhD on something, biogenesis, something, some PhD, some high-level PhD. I say, you brought up 6 wonderful professionals. That is not a housewife. So she said, wow, I never saw it that way. I just, she always saw herself because she was always suffering from depression. And I told her, I want to get you off from the antidepressant. I want you to see the hypnotherapy. And I want to get to your subconscious. Because I don't think you are depressed. You just are not appreciating yourself for what you have accomplished in life.
Touché.
And I spoke with Pam, my hypnotherapy, with this service for free. And we took her off from antidepressant. She's a proud mother. And grandmother now. That's the difference in what you do and so many other physicians. So I think what we are saying here today, it can be life-changing.
Yes, it's going to be life-changing for all of us. For the people who work for you, for the people who come in to see who your patients are. That will be the wall of honor. You got to think of a great name. That's it. You're going to put them in all. Oh, yes.
Yeah, you
get a little 8x10 frame. You can buy these. They're very inexpensive and you can just put on plain paper. And I mean, we can, I would type them up for you, but I don't think I need to do that. I think you can get your staff to do it, but start with your patients today.
I'm going to start with my patient.
Would you like to be in the wall of honor?
Right.
Oh my gosh.
And basically what I'm going to do, because you have to be fair, we'll do a committee in the office so they can put and select, out of the applicants, this person have made the wall of honor.
And I think that actually you should be there with your stuff and maybe some of your staff. They'd like to know. They don't know about a lot of you.
Right.
I think that's another thing how you can have it.
A lot of patients, sometimes the office manager, she'll put something about me with taekwondo or something. I say, oh my God, I didn't know.
Right.
You're a taekwondo black belt. Right. I'm a grandmaster.
Right.
Yes, I'm a black belt.
Right, but that's it. But It's everybody. Yeah. I mean, and I think you will find that person Motorola from Israel. I mean, now he's gone, but he won't be gone because he'll always be up there.
He'll always be up there for other
You're going to have to, you're going to have to expand. And you could have it in the walls, upstairs, everywhere, in the bathroom. They could be everywhere.
Yes.
I'm really fired up on this. Let me give your phone number out.
I'd rather do that than putting diplomas and stuff like that. That doesn't make so much sense. Yeah.
That's right. No more diplomas. Just the other people are. Okay.
People.
See, it's funny. Richard, I've stolen his thunder because he is a creative idea man. He's always giving. He's the one that told us we should do the veterans. He's always told me about so many things. And so I came up with a good one this morning. He loves it. See, he had a mother died of Alzheimer's, and she's nowhere, only in his mind. But what if she were your patient? She'd have
She'll be there.
Absolutely.
Exactly.
We're going to do this.
We're going to do it.
I'm quitting my job. I'm coming to work for you.
We're going to do it.
Okay, so let me just tell everybody. Listen, go to Dr. Mencia. You're going to now be famous. AGI Medical and Dental Centers.
You might make the wall of honor.
Make your wall. We got to name that wall something. Anyway, AGI Medical and Dental Centers in Fort Lauderdale. They're on East Commercial Boulevard, 954-489-1345. They are open on Saturdays. And if you did hear us on the home visits and you know someone that really needs this, please do call. You also could go to Boynton Beach. We have a lot of listeners up in Palm Beach County. 561-270-6494. And their website, very important, agifl.com. Something that, just really quickly, you have two fabulous nutritionists who really do a great job for people. Just now we passed the new year, and so everybody's worried about their weight. I know I'm back on Smart for Life, and we have to make sure that we take care of that, and that's part of your health care.
Yes. And we've been, the two
they are great women.
They are great.
I don't know how you found
women.
them. They're great.
God found them for me.
I guess
they're both great. Yeah, they're both great. And I'm so proud of both of them. And Courtney does such a great job. She goes way beyond just being a dietitian. Yeah. She's really
what do you tell her about
with Smart for
what
Life.
Do you about what? Yeah, right. What do you tell her about this whole new idea? Now all my patients get to put that up. Right?
Oh yeah, she'll be all over it.
They may want before and afters. Who knows?
Yeah,
yeah. And the same thing with the dental. You can have the before and after, what they look like. They may not all want to do that, but this wasn't for that. This was the idea.
This more for the social.
I know.
The social part of who we are as patients.
Right. And they're going to bring people in and say, I'm on Dr. Mencia's walls.
Yeah.
Oh, no. It's a great idea.
Yeah. I think so. We're going to do it.
I think you should do it. I think it's...
I know my staff listen to the show, so I can hear
them.
Okay,
staff, what do you think?
I can see them already as soon as I arrive. Right. They are all gone home, ready to take on this.
Well, it's because people, when they're gone, where are they really? But they've been in your practice. Your staff have taken care of them, and they're always there. But more than that, your staff, they don't really know who these people are. Mm-hmm. You may not know who they really are.
Exactly.
They're going to say important things, and that's the only problem. You're going to have to, because you have a minimal amount of space. Right. You have to figure out what's important to do it. It's going to take someone who's got a little bit of
creative. And I think it's so beautiful because of the stupid privacy and all this BS that we talk about in healthcare, And we follow all of the rules and regulations. We follow the law to the T when it comes to privacy. But the social part, I really hate it when I talk to you in an exam room and I tell you who I am and you take good care of you and you say, I'm so proud of you. And then I go to my checkout person or to my scheduling person and they treat me like nothing. I say, wait a second, this guy Anita just brought me up for what I have accomplished, and now I'm here. I'm not going to keep saying to everybody who. But if we have something that everybody can go and read and say, oh, my God.
That's right.
Dr. Mencia did this and did that. Oh, my God.
I agree. I think so.
I think it will bring the whole service of the team that we have.
Oh, it will. And society. And I think you're going to find, I tell you right now, you're going to find other medical practices doing the same thing. I think we've started something.
And sometimes we see conflicts in my office because you get people that are in a department in the back, and we're almost done. We get people in a department in the back, and a patient has an issue, and they say billing department will come forward. And the patient will tell the person that comes from the billing department, do you know who I am?
You know who I am?
I am the first patient that Dr. Mencia had when he opened his practice. I don't know how long you've been working for him, but I'm telling you, he respects me and this and this.
See? So now they're going to be able to say, you know who I am? Go look at my You'll see who I am. I love this. I'm so happy. This was so wonderful.
What a wonderful idea.
Yeah, well, we make good music together.
We do.
That's what it's called. Anyway, we're so excited that you've been here, and we appreciate always that you take the time. And everyone go if you need the best doctor.
Both medical, dental are open, both office, or if social. You need anything. And we're doing crowns in 24 hours.
Yes, you are. I know that's
sometime in a day.
That is amazing. Now you don't have to wait around. And go see his beautiful tie today.
Oh, yeah.
Yeah, you want to go see him. Hand-painted tie. Thanks, Dr. Mencia.
You're welcome, Anita. You're always welcome. Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia.